Amazing. So thank you so much for everyone who's joining us this morning/afternoon, depending on where you are. So today we're going to be talking about how we can help out some of the medical needs of the Palestinian people right now. So I'd like to first and foremost introduce Humanity Exilium's founder, Dr. Fatia Alvi, who is just going to share a brief little update and just share some information about what's going on and just in ways that we can help. And then we'll also hear from our medical chair, Dr. Mosina Chakladder, after that. And then we'll hear from some of our esteemed guests as well. So Dr. Alvi, if you'd like to share some words.
Thank you, Nathan. Hello, everybody. Assalamu alaikum. Can you hear me well? So today is our Eid Day in Canada, from where I'm talking about. I'm speaking to you from Calgary, Alberta, Canada. And me and my fellow doctor colleagues from US and Canada wanted to spend our Eid Day with people in Palestine. You don't have to be Palestinian Muslim to speak up on what's happening in Gaza and Al-Quds, our Masjid al-Aqsa. So Palestine is not an ethnic or religious issue. It's one of the humanitarian and universal concerns. We have two nations now, one with all the firepower and one is more vulnerable. And especially my fellow colleagues in US, they should keep it in mind that US military aid for Israel was $3.8 billion. It's $3.8 billion in 2019. Israel also benefits from $8 billion of loan guarantees. My colleagues in US should keep it in mind that it's their tax money. So Ramadan in Palestine has started with bombing and ended with bombing. I'm sure that every one of you has heard by now of the situation in Palestine, from the demolitions and illegal evacuation of the homes in East Jerusalem to the siege on Al-Aqsa Mosque, in the holiest night of the year for Muslims, to the bombing raids on apartment complexes in Gaza, which have so far killed 84 people, including 17 children, and wounded more than 480 people. So this is not to mention that worshippers praying the mosque were in the assault on one of the holiest sites in Islam. So now more than ever, because of the extent of atrocities, people are talking about Palestine. People are talking about war crimes, and more people are gaining awareness of the issue and being more vocal about it. My telephone call, let me just give me a second. Sorry about it. So now people are asking what they can do, what can be done. And people are seeing the videos of Palestinian children wailing for their recently deceased parents and mothers wailing for their recently deceased sons and asking what can we do to help people in Palestine right now. I'm not going to talk about politics further. I already talked about what's going on from the US aid to Israel, but as a physician, as a human being, as a mother, we want to address most what people of Palestine need, especially Gaza, through the last decade of blockade and constant bombardment by missiles. They are suffering. Gaza is suffering now, and they need our help. A significant portion of the residential Gaza is literally in ruins right now as a result of sudden attacks on civilian apartments. So we're today on our Eid Day, we are here with doctors who are from Palestine, especially doctors from Gaza. I will see if we have Dr. Alsaka. Sarah Alsaka is here. I think she's not here. So I will invite Dr. Ibtihal Alassa from Turkey. She's joining us from Turkey, and she's a medical doctor. Dr. Alassa? I think we may have internet connection. Actually, Mosina, do you want to speak first before Dr. Alassa and before our guests? And if Sarah can join us. So Dr. Sarah is joining us from Gaza right now. She's a surgeon and she's on duty right now. So we will have our medical chair, Dr. Cheklada,
Hi, good morning. Assalamu alaikum. Eid Mubarak, everybody. Can you hear me? Is everything clear? Thanks. So thank you so much for everybody who's listening to this really, really important discussion. And I'm happy and proud of each one of you that you could, spare a few moments on Eid day to bring this issue to utmost attention that it deserves. Like Dr. Alvi mentioned, that this is a humanitarian crisis. It has, there is ethnic cleansing going on, and people are suffering on a day-to-day basis, especially children, women, and elderly. So we overnight thought of this webinar, and we were very happy and glad that the physicians from Gaza can join us to paint a picture of what's happening on the ground and how we can help as an international society, as a humanitarian society. Without further ado, since Sarah is on call today, I would like to hand over to Dr. Sarah to let us know what's happening on the ground. Since Monday, what have you been noticing? How was the healthcare infrastructure before it all hit because of the pandemic? And now what are you facing there?
Hello, hi everyone. My name is Sarah. I'm a surgical resident living in Gaza and working here at the Shifa Hospital, the main center hospital in Gaza. I hope that everyone already knows what's happening, but just in case no one have the updated information, let me just give you a small hint about what's happening. After Sheikh Jarrah situation and how they are trying to ethnically cleanse all the neighborhood from Palestinians and steal the houses and of the Palestinians and just hand it over to the Israelis. Everyone in West Bank and Jerusalem were starting to speak about it and just reject this act, and nothing happened. No one helped to stop this, and they continued trying to steal the houses, and they even got furthermore in their brutal attack to the innocent worshippers in Al-Aqsa Mosque, the third holy mosque for all the Muslims around the world. They entered, they bombed it, they started shooting inside it, and they even burned a tree inside it. So everyone got angry, and eventually they started bombing Gaza as well. And since well, let's say the media do not actually tell the truth about what's going on. I wish I had more time to explain everything happening in Gaza, but I can just tell you this. They are targeting the residential towers. They are targeting the homes of innocent people. They are killing children and women and elderly. I'm seeing a lot of heart-aching scenes that no words can describe. They have demolished 3 residential buildings that contain more than 80 to 90 family house inside it. So now there are a lot of Palestinians heading toward the schools sheltering there because they have lost their homes and waiting for this war to end. Today they continued hitting and bombing innocent people. They even destroyed 7 houses without previous notice. Sometimes they give notice, sometimes no. And today they just hit the houses without notice. And while the ambulance and the people trying to lift the rockets and just help those under the ground and under all the demolished houses, they striked another bomb. So it's I don't really know how to describe it. I'm not a politician, and I don't know how to say it, other than it's complete inhuman what's happening. It's insane how no one is talking about it, how no one is just standing there for the Palestinians and for what's happening. No one is actually trying to stop this or help spread out what's happening and what's going on. Let's say we in Gaza wish for this to end soon, but we know that it might take longer than we anticipated. We thought that it will end up by yesterday or the day before, and that it will just take 1 or 2 days, but apparently no. Just half an hour ago, there is a Beitul neighborhood have for more than 4 hours. They have been continuously bombing that neighborhood for more than 4 hours now. So I don't know what else I can say about the situation, but we're trying our best. We're doing our best here at the hospitals, covering the shifts for extended hours to help out as much as we can, and even with the small with the little number that we are, or with the with whatever we have, we are trying to make it work and try and save lives as much as we can. Thank you for having me today. Thank you for listening. I don't know what else.
No problem. Yeah, thank you so much. Dr. Sarah, what about your family? How, it must be so concerning. You're in the front line and you're looking after patients, and I'm sure you're worried about your own family. Like, how are you handling all that? And,
Well, this is my biggest fear. Let's say that same as in 2014. 1 minute. Now, while I'm talking to you, they have killed 6 people from the same family. They have demolished, bombed their house, and all of them have died. 6 people, anyway. So regarding my family, it's not just me, but every single physician. Our biggest fear is to be standing in the ER and to have one of our family members coming as a patient or as a, I don't want to say it. Anyway, we know that there is no place safe in Gaza, and that they can bomb every house and any house at any time. But we come here and just wish for them not to. Yep.
Thank you very much, Sarah.
They will be safe. Until thank you.
Thank you very much, Sarah. So Sarah is a surgical resident and she's on duty right now. And thank you very much for taking time from your precious time. And just want to tell you that we from Canada and my fellow colleagues from US, we are standing in solidarity with you people and I cannot imagine what you are going through. And one of the worst fear that you have as an ER physician, that one of your loved one is on the table in front of you. So we wish you all the peace, and we will do whatever we can, just especially for the medical relief, whatever we can.
Yes, for sure. We'll definitely be in touch. Before you go, Sarah, can you let
Thank
us
you.
know what you need the most there? I'm sure you need everything, but is there something that you really need on a day-to-day basis and you're seeing?
Yeah.
Yeah.
Well, on a daily basis, I can just tell you this. We need you to speak out.
Yes.
And to tell everyone about what's happening, and to just stand with us and pray for us. Yeah.
We will. We will. Thank you so much for your time.
Okay, thanks. I have to go.
Okay.
Bye.
Take care.
So I think next we have Dr. Ibtihal Jamal Alassa, and she's a physician. She is right now speaking to us from Turkey. So Dr. Alassa, tell us a little bit about yourself, because I know that you have worked in Gaza for many years, especially in 2014. And you have lots of experience, and tell me that what's it like now, what's your current informations, and a little bit about the conflict that last few days, especially what's going on.
Yeah, thank you. Actually, we are standing here today with heartbreaking. Now that's Eid coming, and all the Muslims around the world celebrating Eid, except Gaza, except the Palestinian who are celebrating their Eid with more than 500 injuries, with more than 80 people killed. 20 of them were children, and 10 of them were women, and about 500 homeless, as Sarah said, seeking for in schools for sheltering. So what happened now? Actually, it's not something new kind of in Palestine. It's happened always, and it started like 70 years ago. And the world just forgetting about Palestine. When just they flare up, they lock it up and say something happening. But actually, that's what were happening long time ago. Which started in Al-Aqsa Mosque, where the Israeli soldier attacked the worshippers who were praying during Ramadan inside the mosque, shooting them with the guns and with the rubber bullets and with the tear gases. And what something shocking, that more than 10 people from the worshipper in Al-Aqsa Mosque during the last days of Ramadan lost completely their eyes from that rubber bullets, because the Israeli soldiers are on purpose. They are aimed to put that bullet in their eye, so they lost their eyes. And what happened also that they prevent the paramedics and from applying the first aid and from entering the mosque. They close all the door, and they prevent the paramedics from doing their job. Even they are wearing their logos with like the Palestinian Red Crescent in Al-Aqsa, they prevent them from doing their job. So it's nothing. It's not something that's new in Palestine or Gaza. It's happened always, and I think that my friend Hala can speak more about the previous war that happened in Gaza in 2000, and since 2008, 2012, and 2014. That's what were tragedies. So what we can say now, that the most thing that's horrible, that the media and during in the whole world, they didn't give the real situation about what's happening in Palestine. I was volunteering in a Shifa hospital during 2018, and before, like 1 year ago, like 2017, when the Great Return of March started, you know that most of the people in Gaza moved to the border with the Palestinian occupied territories land, in contact with the Israeli soldiers. So they it was horrible days where they have like injured with some kind of bullets that's exploded in their body to many parts of small bullets that lead eventually to limb amputation. So they are in purpose making people disabled for the rest of their life if they didn't make them to lose their life. I was working I was volunteering in the obstetrician ward, where something very shockable, that you are working in a labor room where a woman give birth to a new life, and just next to the window, I see the mortuary with Al-Shifa hospital, where the killed people are came, and they took them. So something that a new baby were born, and in the same moment you can see like 2 or 3 in each day of Palestinian, of Gaza guys killed. So yeah, nothing. I don't know what to say more. That's just something horrible, really.
Well, thank you so much. I know it must be very difficult to even narrate all these events starting from 2008, 12, 14. But, like you mentioned, do you think there has been any change since then, like in terms of the world seeing all this, or the, international aid? Do you think there has been much change?
No, actually, no, I don't think that there's a much change more during in this period. Maybe this time, because of the social media, because of the Palestinian who are famous on social media, they started like to notice that something happened. But the formal media in America and in Europe and in they are like they are lying, and they are doing the wrong things. Yeah, like in a few days ago, one of the settler in Jerusalem, he just hit 2 Palestinian guys with his car under the Israeli soldier protection. That the most of the settler attack in West Bank or in Jerusalem happened under the protection of Israeli police. They protect them. And then the most shocking thing, that one of the media of America, they show it the news like it was a Palestinian guys who the CNN and BBC view the news that this one is a Palestinian guys who hit the 2 of Israeli settler. Yeah, so there is a lot of lying in news. So we can't expect from the world to move to Palestine or to help them if they see the wrong news.
Yeah, no, that's for sure. Thanks so much for your time. It's not possible for us to understand what's happening, and we can just imagine all the atrocities that you're facing on a day-to-day basis in terms of all the health issues, food securities, and all the terror that you're living in. But just like we asked Dr. Saba, like, what do you want the world to know? I mean, you already told us a little bit, but what can the normal lay person know from Canada or the governments know to help Gaza?
Yeah, to support as much as they can the medical situation in Gaza, especially in Gaza, because they already in the normal situation they have lack of all resources, and even you'll be shocked that the doctors who work like 24 hours, and now they have to leave their family under the dangers, because if they even leave the hospital, they will be in danger. So they had to stay in the hospital like 24 hours working and in their worrying about their family. There's this doctor in the normal situation, due to that bad economic situation in Gaza, they didn't like get their salary, or can you imagine that? I didn't want to say in this way, but just a simple thing from the doctor rights in Gaza, that they didn't take their salary because of the bad economic situation, because of the due to Israel thing, and then they are keeping working, and also that during to maybe the most horrible thing, that when the medical worker stay unable and stay unable to do anything for most of these injured people, because they don't have the resources or the ability to do it, because they don't have the enough spaces. In some days, I think Hala can explain more, because she saw these things in her eyes in the previous war in Gaza, like the emergency will be crowded with many people. So in a same, if you go to this patient, the other patient will die. So because you don't have a bed, and you don't have enough oxygen, enough surgery, empty surgery room to do their emergency surgeries. Also, there's sometimes the Israel attack when they attack the roads, and they prevent the easy movable from to the hospital, the emergent like the ambulance and these. So there is a lot of need to like a field hospital, or something like mobile clinics. So
I see. Thank you so much for your time. Yeah, go ahead, Fawzia.
I cannot imagine, after hearing from our first physician, Sarah, and now our second physician, that what you guys are going through. As a physician working in the West, we cannot just imagine leaving our children in danger at home, going to the hospital, working for 24 hours, more hours, just to stay safe inside, and having this fear that one of your loved one might be on the operating table in front of you. So
and also feeling the disability of, you are feeling that you are disabled to do anything. Maybe sometimes you are disabled to do anything for these injured people, and you feel like you are not doing, as a doctor, you are losing lives in front of your eyes.
Now you are not able to do enough due to the lack of the resources, lack of the medication. That's what we are hearing. So we are in touch with Gaza hospitals, and they are saying that they need everything. So we will go to hear from the pharmacist Hala. She's joining us from UK now, and she has worked in the previous wards in Gaza for a long time. So Hala, please share your thoughts, that what's your experience like, and also what you think about the current situation, especially in this Ramadan, the last few days.
Hello all. Firstly, I want to thank you. Appreciate providing us this opportunity to talk about the health situation of Gaza Strip and all health challenge that the Strip faces during these days. And firstly, I just want to start by an overview of the situation in the health system in Gaza. And here I'm not talking about my personal point of view. I'm talking about reports and data were provided in last reports by international organizations like UNRWA and WHO, World Health Organization. And the situation in Gaza, we can say that Gaza Strip experiences a long-term socioeconomic decline resulting from conflict and closure, which impacts the education, the income, increase the unemployment rate. Regarding the health system in Gaza, the health system experiences a lack of adequate infrastructure, health services are interrupted by continuous power cut, and also the facilities in Gaza Strip are overstretched. Medical staff lack the opportunity to be trained to face and deal with all these tough situation. You know, as physician, this thing constitutes a burden on the health system, and especially in an area like Gaza Strip. Last reports by WHO shows that the Strip experience different health challenges like decreasing life expectancy, increasing children mortality rate. All this stuff, all these things threaten the health of population in Gaza, which is already at risk because of because of food insecurity and the psychological trauma that the population experiences with every attack on Gaza Strip, especially among children. Their mental health is at risk during the normal days. And when I say normal days, I'm not talking about days similar to these days. I'm talking about days when they experience closure, when they experience like short-term attacks, because we don't have normal days. We don't have normal life in Gaza. So we can say that these days are just like I couldn't express how much devastating it is to go through all these events, to go through all these experiences. I'm not talking about myself. I've recently left Gaza to continue my study in UK, and for me it's very difficult. These days is very, I feel like I cannot explain, but maybe some people think that people outside Gaza, I mean people from Gaza who are now outside Gaza, are in a better situation, but they wrong, because you cannot imagine how our feelings are. Our eyes stuck to news platforms, and also we are scared of the moment when the name of one of our families, friends or neighbors suddenly appear on screen as a victim. So no one can imagine what Gaza and people from Gaza experiences during these days. And regarding the health system, I think it's not only from it's not only about, for example, rebuilding the facilities or just support infrastructure, because we are talking about a fragile system in a war-torn area which need a lot of efforts, and there are already a lot of efforts by national and international NGOs, and we appreciate all these efforts. We appreciate all these projects that currently working in Gaza, but unfortunately, what happened in Gaza during these days, I think all these things, all the set of the whole situation constitutes an emergency, constitutes a health emergency. There is a critical need in the health system for medical professionals, for resources, and when I'm talking about resources, I mean financial and human resources, and not only providing the resources, but also our system needs the support to lead and to manage these resources efficiently, especially as we have unstable situation in Gaza. And from my work experience, I worked with Ministry of Health during 2008 and 2009 in managing drug donations during the war happened at that time. And I also experienced the Israeli attack on Gaza Strip in 2012 and 2014. And I've worked with different international organizations in different health projects. I've worked in the field, and I've visited different parts in Gaza Strip after the last attack. I mean, the one in 2014. I think that what's happening in Gaza this day is similar or maybe more devastating than the last one. And the last one constituted a huge efforts to, we are talking about everything, that the system is completely fragile. There's a huge need to a lot of efforts actually. And for example, I can just quote from reports of UNRWA about, for example, the number of injuries during its report in 2019, and the report showed that there were 28,000 injuries in Gaza Strip during the first year of the Great March of Return. 172 are permanently disabled. Among them, there's 36 children, and there is also 21 people got amputation. So we are, and this report, this is the report of 2019. So it's just less than 2 years. So no one can imagine what this health system can deal with, or how can it deal with. We are not talking about doctors. We are talking about the whole medical staff, the whole medical professionals, from doctors, nurses, physiotherapists, pharmacists. All people work in the health system are in a huge need to be trained, to have the resources they need. And as a medical professional worked in the field, the most difficult thing I've experienced, I've been trained as first responder with the Palestinian Red Crescent Society before the attack on Gaza in 2014. And the most difficult thing I faced that time, that I wasn't able to provide the need. Urgently need to provide the help and the support to people in need, but I couldn't because of not being able to move, because of continuous airstrikes. So sometimes even you have, for example, we can say the minimum ability to help people, you cannot provide it. You cannot provide it even to your neighbors. So because you aren't able to move, you aren't able to leave the place where you are. The only thing you can do is just helping people in your, in the place where are you, even if it's, for example, a school, a street. And during this war, if I talk about this as an example, for my family as an example, we've left our house, we fled our house, we've fled to another house, then it was bombed, then we go to another house. We've changed like 5 houses during this time, and we've experienced, this situation when people lost their home. We can say them everywhere in the street. They couldn't find place. Sometimes some of them go to mosques, some of them go to schools, and no one can imagine, I don't know, I feel like I couldn't see, not that I couldn't see more, but because there is a lot of things that I want to talk about, but I feel like there's a lot of ideas that I can't, the only thing I can say is that the situation in Gaza is devastating, and we experience unbelievable and horrible situation, and especially for medical professional, because you can say that these are the ones who can provide the help in this situation, but they couldn't because of the lack of everything they need. I'm not sure if you have, for example, a specific question, and
Thanks, Hala, so much for giving that detailed account. In your voice and in your eyes, we can see that you're, even if you're not there, you're, in a lot of pain. Are you able to be in touch with your family there, like in terms of like phone connections, internet connections? Are you able to still contact with them?
I can see that I can't do it all the time, because they have a power cut, and when they have power cut, it's for a long time and they couldn't have internet connection. And 2 days ago I've experienced one of the most difficult situation in my life, because during my talk to my sister, there was a bomb and she screamed, and I couldn't hear her voice. So sorry. So I just screamed. I just tried to call her again and again, and then when I call her, okay, she was okay. We can say that people, it's a difficult situation when some people ask me if my family is okay, or other people in Gaza are okay. No, they aren't. They don't need to be, or they don't have to be physically injured to be not okay, because they already have, like, it's a traumatic. They have the psychological challenge to tolerate all this situation. It's very difficult for them. And for, as one from Gaza and currently is outside Gaza, each normal sound for people here, like an ambulance taking someone to the hospital or a plane flying in the sky, these things get me a horrible flashback. I feel like someone pressed a button of a time machine that transport me backwards to experience all horrible things that I went through. So even when these things end, the misery doesn't end. So it's terrifying situation. But I hope that all people around the world, and especially Palestinian, who are working or are studying, who are trying to help their country, I hope we can do anything to help. I hope we can add and assist the national and international effort to drive a socio-economic system and sustainable development. I hope we can anything beneficial for people of our country.
It looks like you're going through post-traumatic stress disorder yourself. It must be very hard for you to see your people and, in a way, not help them directly at the moment. But thank you so much for sharing that. It must be so difficult, to do that for you. We will try our best in any way possible, and we will continue to work towards helping Gaza and all the people there as much as we can that are in need. And that's the reason we're trying to hear from you and the other doctors working in the field there. Fawzia, I'll give it up to you now. Yeah.
Sure. Thank you, Hala. Thank you, Ibtihal. It's so gut-wrenching, actually. I don't have any words that what should I say to you. And just hearing from you, it seems like that, it's very difficult. And I cannot imagine that your family, your loved ones, what they are going through, and not like for 1 or 2 years, for decades. So we will do whatever we can on the ground. I just want to so what we are, I want to tell you that we are going to help through Turkish Red Crescent. So Turkish Red Crescent has been working in partnership with Palestinian Red Crescent, and TRC, Kizlai, they have been providing humanitarian aid in the field of food, shelter, education, water, sanitation, health, while also helping with the infrastructure for the last decade, almost like for the last 10 years. As of 2008, the permanent head of Palestinian delegation has been established in Gaza Strip. And within the scope of Palestinian humanitarian aid operation until today, Turkish Red Crescent has provided humanitarian relief totaling almost about 105 million US dollars. So thank you to Turkish Red Crescent. So Turkish Red Crescent are our partners, and we are going to work with them. So overnight, in the last 36 hours, we have raised almost $45,000. And so we are, Nathan, if you can just put the graph in. Total, we are looking, so we contacted with a hospital in Gaza, and they told us that we need total of $250,000. That's our aim now with the Humanity Auxilium. $110,000 will go to buy a biggest ambulance, and rest of that cost of medical supplies is about $140,000, and we have raised $45,000 only. So we are looking to raise now $200,000 more in order to help the medical professionals inside Palestine, especially in Gaza Strip. So we are hoping that people who are listening, our friends who are listening, they are able to help us raise that amount so we can immediately provide the medical supplies and the fully equipped ambulance. As you can hear from the doctors on the ground, from all three doctors, that we really need that. They need the resources, they need the manpower as well as the resources, and sometimes they feel themselves helpless due to the lack of the resources. Musina, you want to add anything?
Yeah, I think it'll be really important to show our solidarity with the Palestinians at this moment where they're going through such a crisis. They have been going through crisis, but this is out of proportion, and this is really not acceptable in 2021. The only way we can sort of help them come out of it is, if we work collectively, not only by providing aid through donation, but also, like Dr. Sabah said, to spread the word and spread what's happening on a day-to-day basis, so that the Palestinians are not forgotten. Like, they're not forgotten just because they're not in the news and then people just go back to their daily lives. So I think that's what has been happening, and years and years and decades of neglect and trauma is building up, and it's so difficult that people even getting out of Gaza cannot get out of the situation. It's still, they're living in terror, on a day-to-day basis. My heart goes out to you, Hala, and everybody else in Gaza. So let's show our humanity. Let's join hands and do whatever we can, either writing letters to your MPs or by through donation, whichever way you can. Every little bit counts, every act counts, every little penny counts. So I think we should do everything we can in our power.
So I wonder, Nathan, do you have any questions that the people are asking from online? If you want to ask questions from our doctors.
Yeah, I think we kind of asked it, but a lot of people are really wondering how they can get involved, even being so far away, and just a little bit more about the medical needs, because we are still in the midst of a global pandemic, and then you throw in other very complex issues in the healthcare system. So what is it really looking like in that sense right now, and just how desperate is supplies needed, and even just like you also mentioned, it's not just about supplies, but also about having as many people that are trained to be involved. So
Ibtihal, can you answer that first?
Hala or Ibtihal, either one of you can answer.
Okay, I can. This is that the point I just intend to add my talk, because beside the current situation in Gaza, the Strip experiences the global health challenge that almost every country around the world experience, like COVID-19, and some other global health challenge like cancer, for example, and non-communicable disease. So already people with this disease have the difficulty of access to the health service. If we want to talk about health equity, people in Gaza Strip doesn't have the access to the health services they need to, especially these people. And these people during such like situation have the difficulty to continue their treatment plan, to get their medications, and to have access to doctors, and especially if they need, for example, to go outside Gaza, because we have a limited human resources, especially medical experts. So some people need to go outside Gaza, I mean to travel to look or to seek medical help, but they couldn't, especially during this period. We have a very, very long queue for surgeries, like, for example, eye surgeries or other surgeries. And also, if we want to talk about the number of medical professionals available for people in Gaza, or the resources, like the number of beds or the number of hospitals available for people in Gaza, it's far less than their need, because one of the hospital in Gaza Strip already converted to provide a critical care for people with COVID-19. So the number of available or of hospitals can deal with the situation in Gaza decreases due to the other challenge that the Strip faces during these days.
So Hala, you mentioned about COVID. So tell us about what's going on with the COVID vaccines, because I knew that we heard a few months ago last year that Israel was donating COVID vaccines to the other countries. So I wonder what was the situation in Gaza last year and now. Are people getting vaccinated with COVID vaccine now, or what's the situation about the ventilators and oxygen and all of those?
Actually, I've asked about this and tried to collect some information, but the only information I have that the vaccine that provided for Gaza Strip comes like donation. So, for example, when there is a certain number of doses available, some people can take it. Then, if there's a lot of people than the number of donated, there is like a priority. They prioritize people who need, but we can say that the number of donated doses, COVID-19 vaccines doses to Gaza Strip is far less than the need of population in Gaza Strip. And also they have the challenge, because the challenge of increasing the number of affected people, especially before, in particular, I mean, during the period before this attack. So, and the number of people, and the number of deaths also. For example, today we have like 9 deaths because of COVID. So we experience this challenge alongside with other challenges. So regarding the oxygen, actually, to be honest, I don't have information about the oxygen, but the whole thing I know about the vaccine, that the number of vaccines is far less than their need, and it depends on the available donations, and it's prioritized for people who need to get the vaccine. And some of them, and there is a number of them that they cannot take the second dose because the current situation. I mean, the people who are already scheduled to, are scheduled during these days to take the second dose. I don't think that hospitals are ready to get them or available to give them their doses. So I don't think they will get it during these days. So.
Dr. Ibtihal, what do you think in terms of the COVID and the crisis right now? It's compounding and making everything much worse. Are you seeing that as well?
Yeah, just like Hala said, she summarized the situation, the real situation in Gaza, and that's the same happened regarding COVID also in West Bank. Even in West Bank, they have more accessibility to move and to bring the vaccine, but also with the huge numbers of people and every increased infected cases every day, and as we are depending on just donations, so it's really also devastating that till now that the Palestinian people couldn't have the vaccine.
Yeah, no, for sure. It must be very frustrating for that. So I would like to thank you both for taking this time to join us and giving us a glimpse of what's happening really on the ground and what has happened before and what continues to happen. We will definitely follow this very closely. It's very dear and close to our heart. And like we said, we're going to raise funds. And if in the future the COVID situation settles down a bit and we're able to go, we will go and volunteer as well. So we have all intentions of doing that. Thanks again, and I'll pass it to Nathan and Fawzia to have their last remarks, and then maybe we can close up if there are no questions, then close the webinar.
Nathan, do we have any questions?
I guess just another question. I think this was Hala that mentioned this, that you don't need to be physically injured to not be okay. And I think that really stood out to me. So I was just wondering, we talked a lot about the specific medical supports that seem to be pretty strained right now and in some cases non-existent, but what are kind of some of the mental health supports that are available? And if not any, how are people having to rely on their family and their community for support during this time?
I think anybody can answer, Dr. Ibtihal or Hala. Can you tell us that if there is any mental health support available? Because it seems that almost every person is going through post-traumatic stress disorders. Even people who are outside Palestine now, they are going through PTSD. So what sort of support you have for mental health there?
Sorry, do you mean for people in Gaza?
Yeah.
Regarding health projects that work on mental health, I know that there is an international organization work with national organization. I forget its name in English. It's Terre des Hommes. It's a Swiss organization work on health project to support mental health of people. I'm not sure if they, currently if they have projects in Gaza, but I think mental health of the whole population needs also a lot of efforts to be supported. And regarding the support, I think that there's a lot of things that can be made. Like, for example, we can talk about guidelines, we can talk about increasing people health awareness, like training training people to do psychological first aid, and there's a lot of things that can be implemented online also. We know that due to COVID-related restrictions that some people cannot, for example, travel to Gaza Strip, or that feel that they cannot do anything, but using the internet we can reach anyone in the whole world. We can do anything we need to do, and you know, we during by a lot of efforts, by combining and join all of it, we can do more and more.
No, thank you very much, Hala, for answering that. And I think I will wish you all the best. And as Musina said, that we are with you with all of our hearts, and we will do whatever we can to support you. And I just want to tell you that our hearts are beating with innocent people in Palestine, especially as one of you mentioned, that how people are being intentionally disabled. So I cannot imagine how those young people will live, and especially in Ramadan, how many people have lost their eyesight with those rubber bullets. So it's really heartening, and I do not have any words to describe the cruelty of what's going on inside Gaza, especially for innocent worshippers and innocent civilians people.
Yes.
I would also like to mention one more thing. I know it's very difficult, but please do look after yourselves. You know, if you don't look after yourself and you get burnt out, then you can't serve your community, you can't serve your family or the patients that need you. It seems like, you know, I know it's easier said than done, but please look after yourselves as well, and your colleagues, and you know, you're definitely the heroes of the day. So look after yourself. I think Nathan, you had something to play. Maybe we can.
Sorry.
Please go ahead. Yeah.
Hala?
Sorry. I thought you were waiting, Nathan. Can I talk?
Yes.
Yes, we can hear you.
Okay, I'd like to add another point that during the attack of Gaza, I'm talking about from my experience, people around me feel like nobody knows about them, or maybe nobody care about them. So just making such like a live stream or doing anything, just for example posting about Gaza, talking about Gaza, try to support or aid people in Gaza would be appreciated from us, because we feel like people feel our misery, that people try and do their best to help us. This thing strengthen ourselves, so we can just like not feeling that we are dying alone, or that nobody care about us. So I'd like to thank you very much for providing us this opportunity. We really appreciate it.
Yeah, I'd like to say thank you so much for joining us today. I know for me personally, it has really made it real for me, and just kind of listening to everyone speak, it's been super heartbreaking. It's definitely been devastating to hear about your stories and how you're so fearful, even for those of you who are not even in Gaza, just worried about your families, your friends, your neighbors. I can't even imagine what that feels like. So I hope that we can come together and we can help out in any way possible. And I think every amount that people are able to donate, to contribute, any support, any time that people are able to speak out on this, or even take the time to read about it and educate themselves, is just super, super important. I think each of those things can make a difference. So thank you again so much for joining us today. We really appreciate you for being so open and for sharing with us.
Thank you.
Thank you.
Thank you.